Good afternoon, everybody. Doug McGowen with the Joint Task Force for Memphis and Shelby County. I'm joined today by Dr. Taylor from the Shelby County Health Department, and I'll give some brief updates about our vaccination effort, about what you can expect next, about how we've been getting the word out, and then I'll turn it over to Dr. Taylor for her comments. So, through some really good work, we've administered more than 980,000 vaccinations in Shelby County. That means more than 500,000 people, 500,000 people have received a vaccination, and more than 430,000 are fully vaccinated. So it seems like we just began this journey, but here we are with over 500,000 people having received at least one vaccination. We continue to provide those booster vaccinations for anybody who is eligible and wants one. The Pfizer vaccine booster is available for anybody 16 and up, and then Moderna and J&J for those 18 and up. You can get all three of those at the Pipkin building, and at the Southwest Tennessee site and Germantown site, you can get the Pfizer booster there. Recently, we were encouraged at the progress for vaccinating that next cohort of people. That's the 5 to 11-year-olds. There has been a lot of information in the news, but I want you to know that we are not ready to go yet here. There are several more approval steps that need to happen. They will happen the first week of November. After that, we expect to get word and guidance from the state of Tennessee. Once we get that guidance, we will be able to administer those vaccines for 5 to 11-year-olds. Now, we're not just waiting. We've actually placed our orders for those juvenile doses. Those doses, remember, are a smaller quantity of vaccine than they are for the people who are 12 and above. So it's a special quantity. Those have been ordered. They are being held at the manufacturer, and they will not be shipped until we are authorized to begin those vaccines. So we are ready. And when we get that approval, we'll have the 5 to 11-year-olds with the opportunity to get those vaccines. As we continue our vaccine efforts, our door-to-door team continues their work. There are 38 people in the community each and every day. They've knocked on more than 30,000 doors since they've started their work. They have been in every zip code in South Memphis, North Memphis, Parkway Village, and all throughout the city in areas where we have zip codes with low uptake, and we really appreciate the work that they have done. In our partnership with the University of Memphis, we have made now more than 114,000 phone calls and engaged 59,000 individuals in conversations about vaccines and how they might access that, and providing information to get them over vaccine hesitancy. The last thing I'd like to emphasize is the numbers are coming down, but the holidays are fast approaching. And you'll recall when we were at very low numbers back in June, I reported to you then, as did the members of the Shelby County Health Department, that we had a couple of clusters of Delta. Very few. When we started, we had 5 clusters, and that was when we only had about 22 to 30 cases a day, but we had 5 clusters of Delta. And you'll recall what happened when we had those 5 clusters. Suddenly they turned into 30, and that is what started our upward trajectory to get that very high peak that we just experienced. Now we're coming down off of that peak. You've just read the health order that says masks are now highly recommended but not mandatory. Our daily case rate is coming down, but we're getting ready to move into the holiday season. That's when people are coming into close contact for longer periods of time. Now, I'm going to share with you over the next week or two some strategies that you can use to get prepared for when your families come together and friends. But I'd like you to start thinking about this. Know your status before you get together. We have lots of testing capacity, whether it's through a private provider or through one of the many public testing sites. And just before you gather, everyone should know their status. Whether you're vaccinated or not, go get a test and know your status. That way you can get together worry-free about whether anybody has been exposed, and you can avoid being one of those families that starts the next cluster that could be the thing that sets off another increase in daily case rate. So more to follow on that, but I encourage everybody as you make your holiday plans, also make a plan to get a test so you know your status. With that, I'll turn it over to Dr. Taylor for her comments.
Good afternoon, everyone. I'm going to run through some slides first. First slide. Total COVID-19 cases reported to date, 145,710. New cases reported today, 109. That is up slightly from 102 cases reported this time last week, but down from the 122 cases we reported 2 weeks ago. However, there are several days in the past week when we reported under 100 new cases per day, including Monday, when there were 54 new cases. The overall trend appears to be downward. The 7-day average of cases per day is 91. The 7-day average has also continued a downward trend, down from 114 this time last week and 143 2 weeks ago. We continue to see a downward trend in active cases in every age range, including pediatric cases represented by the red line on the graph. Today, we report 25 new pediatric cases and 282 active pediatric cases, down from 326 last week and 558 2 weeks ago. Next slide. The 7-day average test positivity rate is now 3.6%, which is down from 6.8% this time last week. The lowest positivity rate we have seen during the pandemic was 2.3% back on June 21st, 2021. Next slide. The effective reproductive number, or RT, of the virus is now 0.77, a slight increase from 0.73 reported last week. RT has overall trended downward in the past weeks, and that means that our transmission rate is going down and continues to go down. Total COVID-19 hospitalizations today are 140, with 51 in the ICUs and 89 in acute care. Next slide. This chart shows the confirmed cases per 100,000 population for the areas surrounding the Memphis metro area. As you can see, Shelby County is the lowest curve in blue at the bottom. Next slide. When you compare Shelby County to other metro areas in Tennessee, including Hamilton County, which is Chattanooga, next slide, Knox County, Knoxville, next slide, and Davidson County, which is the Nashville metro area, Shelby County's cases have remained lower through the Delta surge. Next slide. Shelby County has lower active case rates than those other metro areas, even though in each of those counties, a greater percentage of the population is fully vaccinated than here in Shelby County, as noted on this slide. Next slide. When you look at active cases by age, you see that while cases continue to trend down across every age range, the percentage of the active cases among the 0 to 17 age range has actually increased to 26.6% of all active cases. This supports the continued masking in schools in Health Order number 27, effective yesterday. The CDC also still recommends masking in schools. Next slide. This map shows active cases by zip code. You see that zip codes 38002 and 38141 currently have the highest number of active cases. Next slide. Active pediatric cases are concentrated in zip codes 38135 and 38018 and 38028. Next slide. Regarding vaccinations, currently 53.6% of the eligible population has received at least one dose of vaccine. 40.8% of the population is fully vaccinated, having completed a series of 2 vaccinations of Pfizer or Moderna or 1 of J&J. That number does not include those who have received an additional 3rd dose of vaccine, which is about 4.8% of the Shelby County population. Next slide. This chart shows the 1st, 2nd, and 3rd doses to date, with the 3rd doses in darker blue. Our goal is to increase the number of 1st and 2nd doses in order to meet our vaccination goal, which was set at the beginning of the pandemic and at the beginning of the time when vaccines were available. Next slide. The goal is to have at least 70% of the population fully vaccinated, and we'd actually like to see that number even greater. You see we are more than halfway there, but we still have a long way to go to reach that goal. That's the end of my slides. Please remember, third doses of both Pfizer and Moderna vaccines are now available at vaccination sites throughout Shelby County. Anyone over 65 is eligible to receive a third or booster dose 6 months after completing the first 2 doses. Others 18 and over who are at greater risk of severe disease due to health conditions or occupational exposures are also eligible to receive a third dose. And with that, I will yield to your questions.
Brad Broders, ABC 24.
Thanks, Dr. Taylor. If you could just talk a little bit, I know the health directive was lowered, was announced yesterday. Could you talk a little bit about the rationale that you all had in easing the mask requirements inside businesses? And sort of follow with that, what would you tell the public out there inside a restaurant or a bar moving forward right now?
Great question. So as you know, at the height of this last surge, we were in a high transmission area as designated by the CDC. Now with our test positivity rate being below 5% and the level of our cases per 100,000 population, we are actually considered to be in the moderate transmission category, and because of that, and because we use a data-driven approach and have consulted with our partners on the COVID task force, we know that it was okay to go on and lessen one of our mitigation efforts, which is indoor public spaces and masking. Now, with that said, we also know that you should still be wearing your mask if you are in situations where you cannot safely socially distance. And the last time I checked, a bar meets that category. So we are highly encouraging that if you are going to be in an indoor public space where you cannot safely socially distance and you do not know the vaccination status or the health status of the people around you, that it would be recommended that you continue to wear your mask in those types of businesses in indoor spaces.
And as a follow-up to that, Dr. Taylor, would you advise, let's say you're a hairstylist or a grocery store employee or a bartender or a server, do you think they should keep wearing their masks just to be extra safe around the public? What would be your advice to them?
My advice to them would be that they should continue to wear their masks. They deal with the public every day. There's no way for them to know the vaccination status or health status of many of the people that they're serving. And if we don't know anything else from COVID-19, we know that a lot of people can walk around with the virus and be asymptomatic, meaning they have no symptoms, but still transmitting virus. Chief McGowen just explained that the last time when we were at a very low level, it really only started with 5 clusters and then it exploded. And so I would say to protect employees, businesses, they have the right to continue to require masks. They have that right as private businesses. And it's just safe practice, not only for the public, but for the people that they employ.
Reseda Holgan, WMC.
Hi, Brad kind of covered some of my questions, but I did want to touch base on my notes. While there's a downward trend in active cases in every age, you did mention active cases increasing among those younger than 17. And my question is, what is the holdup when it comes to vaccinating those children between the ages of 5 and 11? I know you guys have plans in the works, but I would like to know if you guys can go a little more into detail about that.
Absolutely. So really the holdup is that all of the federal approvals that would need to happen have not occurred yet. So we know that the FDA met on October 26th to recommend that Pfizer was safe and effective for kids 5 to 11. But the other main step in this process is for the CDC's Advisory Committee on Immunization Practices to meet. That meeting as of now is scheduled for November 2nd and 3rd. cleared. And normally after what we call that ACIP meeting, then the CDC makes recommendations, the full approval is given, and at that point, we would be able to start immunizing those 5 to 11-year-olds. So it really is not a holdup at the Shelby County level, it's a holdup at the federal level right now, but everybody at the Shelby County level and at the state level will be prepared to give those vaccinations to 5 to 11-year-olds once they're fully approved.
Would hospitals be involved in the plan, or would children be going to vaccination sites just like adults have been doing, or would they be having to visit their local pediatrician? And then that brings another question as to the number of children who don't have a regular pediatrician.
Excellent question as well. So I will tackle that in two parts. So the first part, it's like you were here listening to my conversation with Chief McGowen. As you know, we have a joint COVID task force, and we're already talking through those scenarios, planning to reach out to local providers and hospitals, and we have a weekly meeting with them. And so all of the partners that have been involved will continue to be involved in the plan to get 5 to 11-year-olds vaccinated. We'll be able to share more details as we get closer to that date. Now, the other question about children who do not have a regular pediatrician, please be assured that the Shelby County Health Department will be prepared to vaccinate those children who do not have a regular pediatrician. We already do that, and this scenario will be no different.
Julian Parras, Fox 13.
Yeah, hey, I wanted to go back to what you guys were talking about. You said that the trends appear to be going down. Numbers are also going down ahead of holidays. What do you think contributes to that trend going down and the fact that more people are getting vaccinated?
Great question. So not only are more people getting vaccinated, but at least in Shelby County, we know that we've had a mask requirement in indoor public spaces for the past several months, and we also know that we have a universal mask requirement in our schools. And when you look at those comparison graphs that I put up earlier of Knox County, Hamilton County, and Davidson County, even though they have higher vaccination rates than we do in Shelby County, our case rates have continued to be lower than their case rates. And it can't be all the way 100% attributed to masks, but masks have a big part to play in what you're seeing in those differences, because those other urban areas have not had mask requirements.
Got it. And one more, ahead of the holiday season, what would you say would be some advice that you would give to, whether it's to school kids going out on vacation, families going out, traveling somewhere, et cetera? What would you say to them to better keep themselves safe and also, keep cases down in Shelby during the holidays?
Great question. So actually, we would continue to say what we've been saying, what Chief McGowen just brought up. The first thing is to know your status. Just because you're not having symptoms doesn't mean that you cannot have COVID. So if you have a family that's planning to travel, or even a family that's planning to stay in Shelby County and host other family members that are traveling, make sure everybody knows their status, preferably within 72 hours of gathering, to make sure you know what page you're on. Because if somebody does become positive, you know that that family member needs to stay home and they need to isolate. The next step is, if you know anybody in your family who has not been vaccinated and they are eligible, and we have our fingers crossed that that eligibility group is going to grow within the next couple of weeks, make sure that you're taking advantage of the COVID-19 vaccination. It is the best way for us to not only protect our families, but to protect our community and to finally get through this thing that has caused just so much death and so much sorrow in our community. We can do this together, but those are the things that I would say. And then the other thing is just to practice social distancing. Even if you're in your own home, if you know that you don't know the vaccination status of everybody in the household, if you're going to have family members over that you don't see very often, you want to make sure that if you don't know the status of everybody, that you're being safe. We know people want to gather. We know people want to celebrate the holidays. Just be safe about it. Use some common sense and do the things that you already know how to do that have gotten us to this point.
Jane Roberts, Daily Memphian.
Hi, Dr. Taylor. I'm just wondering what role the schools might be playing in the vaccination of children, because we know sort of the position they've been in with vaccinations in Tennessee.
Great question. And so I can't really speak for what the schools will do once 5 to 11-year-olds have been approved. But what I will say is that the schools have been great partners with us in trying to keep kids as safe as possible, particularly since they are back in in-person learning. And I will also tell you that many of the schools have been encouraging their parents to get those kids vaccinated, because they know as well as we do that it is going to not only protect the community, but protect those individual kids and their families and the teachers that are trying to do their jobs and teach them.
Was there a follow-up?
No follow-up, thanks.
Hannah Grabenstein, MLK 50.
Good afternoon. I am wondering on the status of that concierge vaccination that we had been hearing a little bit about a couple months ago, a month ago, something like that. Are we still doing, is the county still doing vaccination, like the clinic coming door to door for people who are looking for example, boosters, or will that be in place when children are being vaccinated?
Great question. So all of those details are being worked out. I know that the city of Memphis and Memphis Fire has continued their Health Navigator program. And as far as children are concerned, we're still sorting that out. We have to be a little bit different with kids because, as Chief McGowen shared, the dose is different. The vial will look different. And in order to cut down on any possible mistakes, we will be making sure that all protocols are understood, all protocols are followed by each and every agency that will be providing these vaccines. And so that's why it's really important for us to wait for the federal approvals, because a lot of this guidance will come along with those approvals.
Thank you. My second question is for parents of really young children who are waiting for, or who are expecting authorization in the next couple weeks. I know that there's a substantial percentage of parents who don't have any intention of vaccinating their children, especially those who think, well, 5-year-olds are at extremely low risk for developing, even moderate or severe disease. I'm just wondering, what would you advise parents of, 5-year-olds, 6-year-olds who are experiencing with a little bit of hesitancy, or just maybe are not sure that they want to vaccinate immediately?
Understood. So I'll speak as a pediatrician here as well as your Shelby County Health Department director. Those 5-year-old shots that those kids have traditionally gotten to start school are so important to prevent outbreaks. Nobody wants a measles outbreak in their school. Nobody wants a chickenpox outbreak in their school, even though a lot of us of a certain age had actual chickenpox. But now all of those things can be prevented. COVID-19 and the vaccine that prevents it is no different. We want our children to be in in-person learning. We want them to be safe. And the higher percentage of kids, 5 to 11, who get vaccinated means a safer learning environment, not only for your individual children, but for all the children that are sitting around them, for the teachers and staff who are responsible for educating your children. The hesitancy, we understand that, we know that it's out there, but we also know that parents pre-COVID were vaccinating their children at very high rates across the spectrum. We understand what vaccinations can do, and the COVID-19 vaccination is no different. It is found to be safe and effective in 5 to 11-year-olds. We already know that the FDA has approved it, and once the CDC comes out and says the same thing, there really isn't any reason to wait. The only reason to wait is if you know your child has some kind of immunocompromised compromising condition, and in that case, you want to talk to your trusted provider to make sure that they approve your child to be vaccinated. Other than that, I believe that it's only going to help us as a community, but particularly it's going to help all these kids who have been vulnerable now for 19 months to this COVID-19 virus.
Stacy Jacobson, WREG. Stacy, I believe you're self-muted.
So sorry about that. Now that you all have dropped the mask mandate and are just saying that they are required, I was wondering if you could offer a little more guidance to people about what arenas and settings it might still be important to wear a mask versus where it's okay to not wear one, regardless of the distancing.
Absolutely. So I will continue to say that first, the mask requirement has only been dropped in indoor public spaces. Let me be clear about that. Masking is still required in our K through 12 schools, daycares, and pre-Ks. Now, after that clarification, what I will say is that we are still highly encouraging masking in indoor public spaces. You still are at increased risk when you walk into an indoor public space and you do not have a mask on. You are still at increased risk for getting COVID-19. And so with that said, it would be irresponsible of me to say, okay, it's okay in this situation, but not in this situation. If you're going to go into an indoor public space, you should have your mask on. Now, yes, we have dropped the requirement, but we are still highly encouraging it, because if you're going into any public space, you cannot safely know the vaccination status or the health status of all the people that you are going to be around. And with that uncertainty, it makes sense to have a mask on, particularly when you're indoors. Now, if you're outdoors in a crowded space where you cannot safely socially distance, that's another instance where you really do need to have a mask on.
Okay, so, and then, I guess if you could just, you've already answered why you guys decided to drop the mask mandate, but just based on what you just said, I think it might be confusing to people why it's not required anymore. I know you said you're following the data, but you know, if it's still the best thing to keep people safe, why not require it?
Great question. So we're following the data, and like I shared earlier, we're following the CDC's indicators for the level of transmission in the community. So we've gone from being a high transmission area to being a moderate transmission area, and that's where that language comes in, where it's still highly recommended that you have a mask on, particularly in indoor public spaces. And so their indicators are based on the number of cases per 100,000 population and the test positivity rate. So our test positivity rate is at 3.6%, which is less than 5%, which puts us in that moderate category. And then our cases per 100,000 are at a point where we could comfortably say, okay, we will continue to highly recommend masks, but we're not going to require them at this point. Now, with all of that said, if we start to tick back up, and we do not want that to happen, but if we do, particularly with the holidays coming, more people gathering inside, more people being inside, period, because it's colder, then we will have to reevaluate, look at what the data is doing, and decide if we are becoming a high transmission area again. Until then, we don't want to confuse anybody, but we do want you to understand that COVID-19 is still very real in this community. It's still traveling from person to person, albeit not as fast. And if you want to do the most to protect yourself and your family and your community, then we're still highly recommending that you wear your mask in indoor public spaces.
We are out of time. Are there any closing messages today?
Please, Get vaccinated if you are in an eligible population and you have not done so already. Know that boosters and first and second doses are widely available across the county. And please continue to wear your mask in indoor public spaces and in situations where you cannot safely socially distance. We can do this together, and we're looking really good right now, but we need to continue to be careful.
Thanks, everyone. We'll see you back here next week.